Hello students, we'll discuss another important condition, not that commonly seen, but it's not uncommon, that is in perianal region. Similar conditions common are piles, fissure, fistula in perianal abscess. So just find out what this perianal condition is. So look at that, see that here there are small warty lesions here, projections, proliferative lesions in the anal canal, warty lesions. So what this condition is, it is Condyloma acuminata. Condyloma acuminata is a condition which is usually a viral infection. What are the features? It is human papilloma virus, HPV. 4-6 is the common cause. We have got so many HPV. HPV-16 is mainly intraepithelial anal carcinoma. It is in not, whereas here it is 4 and 6 for Condyloma acuminata. There are warty multiple lesions, often at in large size, that is called giant Condyloma acuminata. When it becomes destructive and locally infiltrative or destructive, then it is called as Buschke-Lowenstein disease. So destructive only locally. So that is called as Buschke-Lowenstein disease. Otherwise, it is called a giant Condyloma acuminata. All that's part of it. Now, what is the treatment? Biopsy can confirm. Clinically, is very clear. You look at that, you can make out this Condyloma acuminata. So treated by local application podophyllin, interferon gel, 5-fluorouracil gel, wide local excision. That is a very common important treatment. Then oral acitresin drug. That is also very, very helpful, especially in the recurrent cases, large condyloma acuminatas, because it is a viral infection. Remember, HPV virus is the causative agent commonly for this condyloma acuminata. Another entity, similar entity, what is called as Condyloma lata, Lata, that is different from this, that condyloma is a part of syphilitic lesion. It's a bacterial infection. Treponema pallidum, which is uncommon currently in most of the countries. So it is Condyloma lata is due to syphilis, where this is a viral infection. So we should know the difference as such. So this is a very common entity, not very common, but it is seen commonly. So you should know at least as a differential diagnosis as a causative agent. Students, just go through these books, clinical book, very important with you, manual surgery details about all this anal canal and everything, CBM syllabus for UG and PGs, operative surgery details, everything, operative surgeries of any type, major, minor, everything. Digital lectures, widely discussed, most of the surgical topics, including specialties, instruments, surgical specimens, and so on. Please, you can subscribe or you can purchase the Diginar for 1 year to understand surgery well. So students, I hope you understood this Condyloma acuminata well. Thank you very much.